Hello everyone, today we will talk about our research. The name is Gastric. Now let's start. The title is Adjuvant, capecitabine and oxaliplatin for gastric cancer after D2 gastrectomy, a phase 3 open-label, randomized controlled trial. Let's decrease about the big background. D2 gastrectomy is recommended in US and European guidelines and is preferred in East Asia for patients with resectable gastric cancer. Adjuvant chemotherapy improves patient outcomes after surgery, but the benefits after a D2 resection have not been extensively investigated in large-scale trials. We investigated the effect on disease-free survival of adjuvant chemotherapy with capecitabine plus oxaliplatin after D2 gastrectomy compared with D2 gastrectomy only in patients with stage 2 to 3B gastric cancer. Methods. The capecitabine and oxaliplatin adjuvant study in stomach cancer study was an open-label, parallel group phase 3 randomized controlled trial undertaken in 37 centers in South Korea, China, and Taiwan patients with stage 2 to 3B gastric cancer who had curative D2 gastrectomy were randomly assigned to receive adjuvant chemotherapy or 8 3-week cycle of oral capecitabine, 1,000 milligram square meter, twice daily on day 1 to 14 of each cycle, plus intravenous oxaliplatin, 130 milligram square meter on day 1 of each cycle for 6 months of surgery only. Block randomization was done by a central interactive computerized system, stratified by country and disease stage. Patients and investigators given interventions assessing outcomes and analysis stage were not masked. The primary endpoint was 3 years disease-free survival, analyzed by intention to treat. This study reports a pre-specified interim efficacy analysis, after which the trial was stopped after a recommendation by the Data Monitoring Committee. The trial is registered and clinical trials findings. What about the results? 1,035 patients were randomized. 422 received chemotherapy and surgery, 414 surgery only. Median follow-up was 34.2 months in the chemotherapy and surgery group, and 34.3 months in the surgery only group. 3-year disease-free survival was 74% in the chemotherapy and surgery group, and 59% in the surgery-only group. Grade 3 or 4 adverse events were reported in 279 of 496, about 56% in the chemotherapy and surgery group, and in 30 of 400 78 patients, about 600 in the surgery. About 6% in the surgery-only group. The most common adverse events in the intervention group were nausea, neutropenia, and decreased appetite. Interpretation: Adjuvant capecitabine plus oxaliplatin treatment after curative due to gastrectomy should be considered as a treatment option for patients with operable gastric cancer. Finding: Hoffman, Roche, and Sanofi entities. That's the end of the basic research. Thank you for listening.